Today in this ultrasound video we will discuss about ultrasound findings of gallbladder. Gallbladder ultrasound is always performed in fasting condition when gallbladder is fully distended. In contracted gallbladder we cannot rule out any gallbladder pathology. In this video we will discuss about the difference between gallbladder stone, polyp and sludge. Gallbladder stone is always hyperechoic, bright. When we talk about gallbladder polyp, that is echogenic to isoechoic. Sludge is low level echoes, muddy appearance. When we talk about mobility of gallbladder stones are mobile, move with change in patient position. Gallbladder polyp is fixed, attached to the gallbladder wall. When we talk about sludge is always mobile, layers dependently, shift slowly with position change. Acoustic shadow. Gallbladder stones always show acoustic shadow. The key distinguish feature of gallbladder stone always present with acoustic shadow. GB polyp does not show the shadowing. Sludge also does not show the shadowing. So the key differentiation is the gallbladder stone always show the acoustic shadow. Now we will talk about the shape. Usually gallbladder stones are round, oval or faceted. Polyp sessile, broad or pedunculated on stalk. When we talk about sludge shows mass-like appearance or layering. So whenever we need to perform gallbladder ultrasound, we need to rule out any gallbladder pathology, always do in fasting condition. That's all for today.